Indirect bonding fits in with today's orthodontics for patients who have healthier teeth and few or no restorations. And an adhesive has been developed that permits second molar to second molar bonding with cost-effective use of the doctor's time. Unlike an intraoral approach, patient models can be viewed in all three dimensions to facilitate accurate bracket placement. Indirect bonding allows the doctor to take advantage of bracket positioning in three dimensions to use the doctor's time efficiently and effectively. Laboratory setup. Phase 1, preparing the model. Prepare the working model with orthodontic stone. Separating medium. Mix the separating medium and water in a 1:4 ratio. Then apply the separating medium to the stone model to seal its surface. Let the model dry at least 1 hour to assure the seal. The technician is now applying APC adhesive-coated brackets to the stone model. APC brackets are pre-oriented with a consistent adhesive layer that reduces base contamination and bond failures, and helps to construct the custom resin base that is essential to the Sondi indirect bonding technique. The comprehensive APC inventory dispensing system is designed to fit into your delivery protocol. You also have the alternative of applying Transbond XT Light Cure adhesive to the brackets. The initial bracket application and positioning can be done by an assistant or laboratory technician. Note that the models are placed into a light-tight box where they can remain indefinitely until the doctor checks the bracket position. Final bracket positioning is verified by the doctor. The doctor is able to perform final bracket positioning and flash removal at any time. The doctor can be interrupted for other tasks during this time. The model setup with brackets in the final position can now be cured in a light chamber. Once cured, the models no longer need to be stored away from light. One alternative to a light chamber is curing the brackets with an Ortholux XT curing light. By curing interproximally, the mesial side of one bracket and the distal side of another can be cured at the same time. Laboratory setup. Phase 2, forming the indirect transfer tray. We recommend spraying the brackets with a separating layer to make tray removal easier. The models may be sprayed with a cooking spray or a silicone spray. If you wish to block out hooks, you may also use wax or Mortite. If using Dr. Sondi's technique with a BioStar, the tray will be formed in 2 layers. The flexible soft inner layer is formed out of bioplast. The soft bioplast layer is 1.5 millimeters thick. Place it on the BioStar for heating, following manufacturer's directions. Once heated, the bioplast sheet is flipped and locked over the model for suction forming. Open and remove the model with its new soft tray. Check for air bubbles and voids. Trim the excess bioplast and discard. Place the trimmed model back on the BioStar for hard tray formation. BioCrill will be used to form the splint. The stiffer BioCrill sheet is 0.75 millimeters thick. You must peel off and discard its blue protective covering. This must be done on both sides. The BioCrill sheet is also heated on the BioStar. Flip and lock the sheet onto the model that already has its soft inner tray formed. The model is now ready for soaking. Soak the model in water. It needs to soak a minimum of 1 hour for easier separation. Alternative tray formation can be done using a putty and wash system. Laboratory setup. Phase 3.